Hey, everybody, welcome to another Anatomical Gangster podcast. I am your host, Sue Hitzman, and today I had the opportunity to talk to my dear friend and colleague, Aubrey Gowing. He's the author of two books, the acclaimed Myoskeletal and Sports Therapy book, and of course, the newly released Kinesiology Taping Strategies. We talked about that and so many other topics, about his approach on his ongoing interest of treatment overuse, repetitive strains, and chronic injuries. And we're excited to be joining one another this year, October 17th to the 19th. I'll be with Aubrey in Ireland to be doing a stretch and melt event. So for those of you guys really looking to dive into some hands-on therapeutic techniques and take it from an approach of an extremely skilled therapist, Aubrey and I are going to have a ball together, and I hope that you will join us. And of course, if you're joining my podcast for the first time, please subscribe, share this with your friends, and I hope that you enjoy this conversation with the amazing Aubrey Gowing. So Aubrey, thank you so much for coming on Anatomical Gangster and jamming out with me today. I really appreciate you being here. Thank you.
Sue, it's an absolute pleasure as always. I'm delighted to be invited and looking forward to an interesting discussion.
Yeah, I mean, Aubrey, you and I have known each other now for a number of years, and I'm pretty sure I met you because of our beloved and now past Eric Dalton.
Yes, yeah, I think it was at one of the Oklahoma events, probably about 10 years ago, a bit more.
Yeah. Yeah, I
Yeah.
think it was about 10 years ago. And, for those of you who don't know Eric Dalton, I would call him one of the premier hands-on therapists who really changed a paradigm. I mean, I know for me, when I found out about him, I never took any of his live courses. I was one of the ones that bought the VHS tapes and watched them on my television. So I felt like Eric was in my house all of the time. And then when I wrote the second book, Melt Performance, he actually wrote the foreword for me because I feel like neurostrength is sort of the hands-off approach to that myoskeletal alignment techniques. But I'd love to hear, I know that you've done so many things with Eric. How is it for you that this pioneer is now gone?
Oh, absolutely devastating. I mean, it was a complete bolt out of the blue. He had been teaching like a month before. He had run one of his great seminars in Costa Rica, which was one of the first events I attended. I first heard about Eric and decided I was just going to jump on a plane and go to Costa Rica. And I had a very similar experience to you in that after that event, that's usually around Thanksgiving. So when I came back to Ireland, I had bought his whole library because I said, on day three, I think, I said, look, Eric, I've been teaching for years and I really want to teach this work. And I was basically asking for permission. And he said, oh, yeah, if you get certified, go through my whole library. I'm happy because he knows me already through James Waslowski, a mutual friend. Love James, big shout out to Jim. And he said, I know Jim speaks really highly of you. I know you're a good educator. I see what you're doing in class. I'm happy once you get certified. So I had the same experience. I watched Eric's stuff intensively over the Christmas period. So I felt like he'd been in my house for a month. And absolutely had a great time, loved learning the techniques, and then was teaching assistant for Eric for quite a few years, then became senior myoskeletal instructor. Eric came over to Ireland here. We did a combined seminar in 22, and we even shot a course while we were here. Pain Detectives in Ireland. Still available, great course. Eric's a genius. He came up with such a great idea. He said, let's do a thing where we're going to take like four people and we don't take any case history at all. They can't tell us anything. They can only give us yes and no answers. And we've got to assess and treat and try and figure out three primary kind of chronic issues that these people suffer from. So we had four people, three issues each. That was 12 things that we were trying to get right, just purely from assessment and yes, no answers. I won't spoil it. Go watch the course. It's fantastic. But it turned out really well. And it was quite an eye opener. You know, there's not many times when you're like, I'm 36 years now a therapist. So there's not many times when you get those kind of like, wow, real exciting, that kind of musicians jamming kind of sense was what I got. You know, that's one of the things we always say, you know, Eric really brought to the industry. It was that real appreciation of bringing that kind of the rock and roll lifestyle, but also he also oftentimes talked about the rhythm of treatment and things like that. And it's funny how that music influence just carried over into so many areas of what he did. It was a phenomenal experience. Yeah. So an absolute shock and a big loss to the industry.
Yeah, I mean, a real giant. And he really was probably one of the most incredible showmen, also. Just the way that he taught was so, I mean, you were just at the edge of your seat all the time watching him, and always very easy to learn the techniques. And he blended so many different things, but really just, yeah, I agree with you. I mean, it's just such a giant to lose. So,
Yeah.
and I love that you guys, you two have done so many things together. And, I know that you've got your two books the Myoskeletal and Sports Therapy, which I have and I love. And now you have this newly released kinesiology taping strategy. And that
Yeah.
kind of is all just about that whole pain-free concept. So tell me a little bit about the kinesiology. I'd love to kind of start there. What are some of the common misconceptions about kinesiology taping and how would you address them in your teaching?
Yeah, I suppose in some ways people would say, how can applying tape to the skin affect deeper structures? And it's funny, like I see academic papers almost every week, and they alternate between kinesiotape is having this phenomenal effect and kinesiotape is placebo and does nothing. And literally each week it's positive, negative, positive, negative. I've seen phenomenal results with it. I first got interested, I was kite surfing and I was stupidly popped out of the water. I did the wrong thing. I pulled the kite the wrong way. If anybody's a kite surfer, they'll know what I'm talking about. And I got popped out of the water and landed on the beach like 60 yards away. So it was huge. And I was only learning, and I thought it was really funny because when we were going out, the guy insisted we put on helmets. And I'm used to water skiing and stuff, and I'm like, a helmet on the water? That seems like overkill. Until my head was bouncing along the beach, and I went, I'm glad I'm wearing a helmet. But
Wow.
I sprained my big toe. And I went home and I went, limped home. And I went, oh, I've got some of that kinesio tape stuff. I'll give that a try, like bandaging. So I just put some kinesio on it. And I got up and I walked across the room without a limp. And I was like, what the
Wow.
heck? Like,
Yeah.
literally instant change, no pain. I was able to walk. What I was really interested in was I'd heard stories about how kinesiology tape is really good for clearing bruising. And my foot was really like black and blue all across the metatarsal heads, top and bottom. But where I'd put the tape along my big toe, probably about maybe a day and a half after the injury, I took off the tape. And literally that horrendous bruising stopped at the line of the edge of the tape. There was
Wow.
no bruising where the tape had been, and it picked up again in a line on the other side of the tape. So I was like, if it does nothing else other than clear bruising that quickly and that completely, it's phenomenal. But then the fact that I could walk without pain, that was another thing altogether. So
Yeah.
I've
I mean,
seen,
yeah,
go ahead.
sorry, go ahead.
Well, I've seen huge change. Like since I started teaching it, I've even seen people come into class. I was teaching a class in Poland, and there was a girl limping. I only noticed on day two, and she said, "Oh yeah, I sprained my ankle, but I didn't want to miss the class." And I was like, "Why didn't you say? This is the perfect opportunity to really demonstrate real world, what's going to happen." And we talk a lot about like layering up in taping. So you only apply as many layers as you need. So I'm a big fan of apply a piece, retest, apply a piece, retest. So we put a piece of tape on her ankle. She walked back and forth and she was like, yeah, not much difference. And I was going, I didn't expect her to be. So we put on a second piece of tape. And I thought, she's walking a little bit better. And she goes, yeah, it's somewhat better. And it's like, we need a third piece of tape. We put on the third piece, and these are kind of like at different angles. So they're overlapping, but not obviously like
I
one
was
on
going to
top
say
of another. Yeah,
overlapping.
yeah,
Yeah. Yeah.
yeah. So we're basically covering the different angles of the different ligaments on the outside of the ankle. And the third time she walked, she kind of went, "Oh, I've no pain." And I was like, "Yeah, you're also not limping." Like she literally just walked back and forth on the stage, no problem. So that was like a 2, 3 day old, probably somewhere between a significant first degree and a minor second degree sprain. It was enough that she was limping, but she was still able to walk, and it was a little bit swollen. But she literally walked without pain. And I've seen that so many times in class. Treatment will take a person so far, but sometimes if the nervous system is a little bit aggravated, tape just gets them that last little bit. So we were talking about like how can tape being applied to the surface of the body have such a profound effect? It's not very cat friendly, but if you Google YouTube videos, cats and sellotape, you'll see what happens when you put sellotape on a cat. The cat
It
is completely freaked out
freaked out.
because changing the sensory input by applying tape to the skin, you are creating novel nervous system input. And it makes the nervous system kind of recalibrate. And in that recalibration process, it oftentimes helps to distract. We talk about like kind of a counter irritant effect in things like cryotherapy and stuff like that, that it just creates a neural distraction. And so the brain doesn't perceive as much threat because really that's all pain is. Pain is a response to a particular level of threat. Below a certain level of threat, you don't experience pain. Once you pass that threshold, the nervous system becomes more alarmed, more protective, and then the output is pain. So if we can change the inputs, we can oftentimes change that output. Perceive less threat, perceive less pain.
I love that. And I mean, I'm a fan of kinesio taping or, any type of physio tape. And the way that you come about it, you're actually working like, are you giving ways to use the tape to kind of tailor it? Like, I guess,
Yeah.
tailor taping strategies for different anatomical structures, or is it injuries or both?
Both. So I would say that the uses are pretty wide reaching. I would say like the book, the Kinesiology Taping Strategies, is actually part of an online course as well. So in the book, you have assessment and then taping patterns for common kind of musculoskeletal problems, but also soft tissue injuries. So you're not just like randomly taping. You're going to actually test and see, does the person have what you think they have? In the online course, obviously it's the same thing, but there's videos, so it's a demonstration of how to do the assessments and how to do the tests. And it's something like it's over 70 different taping strategies in that book. But I take a very simple approach that really matches what we do in hands-on treatment, where we talk about muscle balance an awful lot, kind of coming up to, we'll talk about our own event that's coming up in Ireland, where we're going to do like
Yes.
stretching, strengthening, and then melting as well, which I think is going to be a fantastic complement. But in therapy, we talk about these kind of predictable patterns of dysfunction, how from particular uses that we have, some muscles become short and tight, and usually they're opposite. Their antagonistic muscle becomes weak and inhibited.
Mhm.
So we're starting off with that assumption of dysfunction. If everybody was perfectly healthy, we wouldn't have to worry about these things. But because we are somewhat imbalanced in how we approach our day to day tasks, we tend to develop these predictable patterns of dysfunction. So in therapy, we would say to restore length to a short, tight muscle, you're going to work from proximal to distal or origin to insertion. And so the taping is going to encourage that because if you're taping a tight muscle, I would say you're usually going to anchor distally and then you stretch the tape proximally so that the draw, the recoil, is going in the direction you want the fascia to move.
Mhm.
So I think it's a very easy transition for people who are used to that hands-on approach to make sense of the kinesiology taping because there is a lot of different philosophies out there and a lot of different approaches. I've studied many different ones, and some will say the direction doesn't matter so much. I find it does. I've even
I think
noticed
it
this
does too.
when we were filming for that book. We did a particular taping. We did a few. There was some on the neck. There was one in particular on the shoulder where the model from my book is a good friend. She's an aerialist, so she's like a professional acrobat. She's phenomenal, incredibly strong and incredibly flexible. And we did one taping for her shoulder, and she straight away she's like, "Nah, of all the tapings, I don't like that one." I said, "Hang on, let's just reverse. We're going to do the same pattern, but we're going to anchor from the opposite end." We put it on. She goes, "Oh, that feels great." So the
Uh-huh.
nervous system knows.
Yeah, the
Now,
nervous system's kind of hard to fool in some ways, but then again, we can fool that nervous system if we know how. So I think that,
yeah,
taping to me is just it's one of the most profound, like you can't even believe that it works. I mean, every time I've had a client where something's not working, I'm like, let's just try a little kinesio tape. Let's just see if that feels. And if you get it right, it's almost instantaneous that their gait pattern changes and you're like, wow, that shit actually works. I'm going to do that more. I think I'm going to come and take your online course now that I know that you've got it online. That's great. I mean, I think that the world now that we are online is so fantastic. I can take people's courses now
yeah.
in the comfort of my own home, which I just love.
And the nice thing about that one as well is that it's not really a course that you're going to do from start to finish. You're going to dip in and out. Most of the videos are like 3 to 5 minutes long. So if you've got a client coming in with something unusual, they've got a something like Dequervain's tenosynovitis or something, you go, oh, I think that's on my course. You can go and watch like the 3 minute video on how to assess for it, and then a 2 minute video on how to tape for it. And if that's within your scope of practice, you can try the taping and see if it works. But it's something that you will use almost as a reference guide. You'll go back and forth. Obviously, you can go through the whole thing, complete it, and get a certification. But it's there all the time that you can just dip in and out of as well, which I think is really useful for therapists.
I love that. I love that. And I think everybody can see on Aubrey's, he's got his logo, the Holistic College of Dublin. And yes, and you are the director of the school. Tell me a little bit about the curriculum, what you guys are looking to do. What is sort of the fundamental principle of the college?
Yeah, well, I suppose we've kind of shifted our focus over the last probably 15, 20 years. It's myself and my sister run the college. It was started by my dad, so we're coming up on 40 years now because he started us in 86. So it's
Wow.
a long, long time. For myself, like I said, I'm 36 years practicing, but I was still involved back then. You were a kid helping out and you were painting around the place and doing whatnot odd jobs. But yeah, literally been involved with this all my life. But our philosophy has really gotten towards, leaned much more and more over the years towards corrective manual therapy. So we do a certain amount of what we'd call complementary therapies here. I think maybe spa therapies might be a more common term in the US, where we do things like reflexology, holistic massage, aromatherapy, hot stone. We don't do so much of those anymore. Well, they were very popular maybe 10, 15 years ago, but I think myself and Alison, our focus has shifted to the treatment of chronic pain and then really training people in the treatment of how to address clients who come in with chronic pain. And we do like a 3-year program where you can start off, you can do just our entry level sports massage and you get a qualification. You can treat like non-injured people and you can do really effective pre-event, post-event, and kind of like myofascial corrective work for general sort of aches and pains, getting rid of knots, that kind of stuff. Knots
I
are just
love that.
adhesions before anybody kicks off with, "Sir, don't use the term knots." There's all these
Yeah.
little,
The
the things
knots.
on
I know
social
that's what
media.
I've said that so many times when I see them ironing themselves like a shirt on a foam roller, and I'm like, what
Yeah.
actually is the principle of doing that? And they're like, I'm taking out the knots on my muscles, and I'm like, do you really believe that your muscle has knotted up? And they're like, yeah, it's kinked, and I'm like, is it kinked? Are those real words? And I think that's an interesting idea that even in the world of fascia, people talk about fascial unwinding and a release, and I'm like, well, what's actually releasing? Is fascia releasing? And I get this idea of like a top, like somebody has wound up a top and you're
Mm.
going to touch somebody and their fascia is going to unwind. I mean, how do you get around some of the terms that are being used today, kind of frivolously, I feel? And how do you try to get people around these, I guess, misnomer
Yeah.
definitions?
That's funny. Myself and my sister were talking about this recently. We talk about loose language leading to misconception.
Mhm.
And I would always say, like, even in class, in therapy, like in clinic, talking to students in particular, I would always say, I think it's really important to do both. Use some technical terminology to display knowledge to your clients. You want to show that you are a well-trained, skilled therapist, but also use everyday terms. And this is what we do in class as well. So I'll say not. By that, of course, we mean adhesion. So you're educating the person. You're starting off with some basic language that doesn't sound scary. They can take it in. They go, "Oh yeah, I know what you mean about knots in muscles." But then we clarify and say, "Well, really, this is when fibers become adhered. They become stuck together and they form into a lump within the muscle. And it's really the fascia that is sticking together." And I would say the release that you're getting is really between fascial sheaths. That these sheaths should be able to glide against each other. But when they become dehydrated, they start to stick, and that's when they become stuck like that and they form into these lumps within the muscle that we think of as a knot. So we really want to try and hydrate and then create shear. You know all about this, Sue. I'm
Yes,
preaching to the choir.
you're speaking my
but,
language.
but but for the other people maybe watching, that maybe this is new. I don't know. The multiple layers that we have. I mean, fascia is so intricately layered. It is phenomenal. Like even I remember seeing one of Gil Hadley's presentations. You probably know Gil quite well,
Yes.
and he'd talk about how even just the outer layer of fascia on a muscle isn't an outer layer. It is multiple layers. It's like 4 to 6 layers depending on where you are in the body, and that's
Mhm.
before you even get down into the muscle. And your different layers, your epimysium, perimysium, and endomysium, all have different layers to them. So those layers are geared to allow you to glide and move. But if you're not moving, they start to stick. So that's really our job, I'd say, in class. Said if you really want to boil it down for your clients, you'd say our job is to unstick the stuff that's stuck.
Yes, I like that.
You
That's
know,
so simple. Yeah, I
yeah,
think we're like the nomenclature that we're using now, I think it really needs to be cleaned up a little bit, but I think speaking to your clients only in anatomical terms just stresses out an already stressed out body because they're just nodding at you and they don't really know anything that you're saying. But I think if you can take scientific terms and simplify it down into either analogies or metaphors to get them to understand what you're trying to get them to do, I
yeah,
think fair enough. That's,
yeah.
that seems like a decent way. So now your first book, which I really loved reading your book, the Myoskeletal and Sports Therapy series. How do you see it impacting the field of manual therapy? Who's reading this book? What do you think people are getting out of it?
Well, I think mostly I talk about like the unbroken chain to achieving success, like really getting your clients out of pain. And I've had like many presentations where, you're up on a stage and you have somebody that you've taken out of the audience and they've maybe 7 out of 10 back pain, 8 out of 10 back pain, and you resolve it in a demonstration. Sometimes it's an hour, sometimes it's a little bit longer. Oftentimes, if you're talking through it, it might be 2 hours or something. But I really think you can get most people at least out of pain
Hmm.
in a session. But you need this kind of unbroken chain of understanding where you need to carefully listen to the client. Oftentimes there's things in the intake that will clue you into, you'll really connect with what they're saying and go, oh, that sounds like this condition that I've treated before. So you're starting to form kind of a hypothesis. Then that should inform what assessments you're going to do, because I like to keep my assessments brief because I want to spend time with the hands-on. So I want to listen carefully so I know what assessments to do. This is where the chain gets broken for a lot of people, that they may know how to do tests, but they're not always sure which tests to do. And the key thing is how to interpret the
Yeah,
response.
very well
So I
said.
think that's the break for a lot of people, because if you can do that, it gives you a fairly clear indication of what the nature of the dysfunction is. So when you go to do your hands-on work, you are then being really targeted, really focused, and you're not just saying like, I treated TFL. I get clients in like this all the time. They go, oh, I've had that worked on. And I'm like, yeah, but there's still like another 2/3 of it that's still dysfunctional. Some of it's been worked, it's beneficial, but have you really gone through the muscle? Have you really dealt with all of the different types of dysfunction that might be present? And if you do, then you should get the client out of pain. And then I think the last step is the maintenance, the home care that they're going to do, whether it's stretching, strengthening, melting, whatever it might be, to keep them in good condition. Because all therapy is doing is creating a window of opportunity in which they're able to move more pain free. If they continue to do that, if they use that time and they maintain that movement, they should stay pain free. So what I think the book is intended to do is there are a load of different conditions listed on it. And it talks about what the condition is, how to recognize it, how to assess that condition, and then a treatment sequence. Because we tend to talk about like these common patterns of dysfunction. So we'd say in each area of the body, you're going to have muscles that are predictably tight that you should treat before trying to address the more commonly symptomatic weak muscles. You're also
Yeah.
going to typically go from superficial to deep. You have these overarching principles. You're going to keep the intensity moderate so that you're strong enough to be effective, but light enough to be pain free. So you're not upregulating the nervous system and causing more stress, more alarm, and potentially more pain. So if you follow these overarching principles and you follow the treatment sequence, you should really have phenomenal success, particularly in the treatment of chronic pain. So I think the book is really intended to be a roadmap for those kinds of things. I mean, we talk about the philosophy in the early chapters, but then we go body part by body part. What are the common injuries? How do you assess for them? How do you treat for them? And then what kind of home care are you going to recommend based on your findings in treatment? So
Yeah,
it's
it's
a
such a
real
great
start to
map.
finish.
Yeah,
Yeah,
I mean, that's really the map for, I think, anybody. Just treating somebody. I always say for the 1 hour I'm with a client, they've got all those many hours before their next session, that one session is not going to compete with it. So if you can bring clients back home with homework to maintain and also move them in a different direction, you really have them coming back feeling better every single time and incrementally doing so much more with them. I'm completely with you on that. Now,
yeah.
I know so Aubrey mentioned that he just recently did this event with Eric, and I got a call from Aubrey saying, hey, do you want to come to Ireland and do an event with me? I said, heck yes, I do want to go to Ireland and hang out with you. I already feel smarter even that I have the opportunity to. So first of all, thank you for this opportunity. So we are going to be doing a stretching and melting event October the 17th to the 19th. You want to tell them a little bit about this idea that came to you and what they can expect coming to this event?
Sure. So I do think that for a lot of people, the understanding of how to provide really quality home care for their client is lacking in our industry in general. So I do feel that there's sometimes people get a little bit too entrenched in a particular approach. Like I know, particularly in the healthcare industry here, they tend to go for kind of strengthening of everything. And I would say that's going to work about half the time. If a muscle is weak, it genuinely will benefit from being strength trained. But oftentimes you haven't addressed the flip side of that coin, the muscle that's tight causing the other muscle to be weak. And if you strength train a tight muscle, it will get tighter and your symptoms will generally actually get worse over time, particularly tendon pain kind of stuff. What usually people will mislabel tendonitis, it's often simple tendon pain. But if you keep tightening and tightening that muscle, you load and load the tendon and it just gets more and more painful. So I think this is really going to help people to understand how to not only perform stretching optimally so that you're actually getting the most out of the time that you're doing, that you're able to target different portions within a muscle, that you're not just saying, I'm stretching my calf. Because I'm like, yeah, that's like at least 10 different stretches that I can think of off the top of my head just to get each portion of your gastroc, your soleus, and your posterior tibialis. Never mind the toe movers. We're just talking about those three guys. The different
Right.
angles to get those different fibers, that really to get an effect, you want to make sure that you're actually targeting the part of the muscle that's most dysfunctional. So getting to that level of detail, I think, is going to be really huge for a lot of people. We'd always say, in exactly what you said, in class, the F word that we have is fix. Say, "Ah, don't use the F word because we don't fix anything. We've only got an
That's
hour.
right.
The client has got to do their part. And if we have, as therapists, are better educated in helping them and empowering them to do that, it means then that the stretching that they do should be brief so they can actually get it done really quickly. Then the strength training will complement that. And it can oftentimes be just body weight. They don't need a lot of equipment. It doesn't have to be the gym. I'm a big fan of the gym myself, but if they're not, that's okay. But then I think if we add in the melting as well, that's something that people can be doing all the time. And I mean,
Hmm.
I've taken some of your work as well, and I've really enjoyed it. I've felt the benefits straight away. And I love the idea that we were saying we're going to go back and forth, that we'll do some stretching maybe, then you're going to do a melt map for that body part, and then we're going to get the guys to try a stretch again so they see the difference.
Yes.
I think that's
And
going to
I
be
think
really
that that's,
interesting.
yeah, I think that's really exciting because, my foundation, when I first, because I've been in fitness for my whole life. And when I met Jim and Phil Wharton, I was introduced to active isolated stretching. And this was at a time, I think I was maybe 22, 23 years old. I had a tear in my meniscus, three tears. I had a lateral horn tear and I had two tears in my medial meniscus. And the doctor's like, we're going to remove it. And I said, I think I'll keep it. And he said, wait, you can't keep it. I was like, well, it's my meniscus, so I'm pretty sure I can keep it. And he was like, well, if you keep it, you're going to be crippled by the time you're 30. And I was like, first of all, my mom had a knee surgery when she was my age, and she said that it ruined her life. And I don't want to be like my mom. I want to have a good life. So I'm going to keep my meniscus. And I went back to Jim and Phil Wharton with this information. And he says, girl, it's all in your hip. It's all in your hip. Your hip is like, you're just so out of balance from all the cycling and everything else. My quads were so locked short. And so I said to him, I don't want to get the surgery. He says, well, you're going to have to come in and work every day. I said, I'm in. I'm in. So I would come every single day and do my rotation of my hips, stabilization techniques, and active isolated stretching, isolating every region of my body. And I wore a brace for about 8 months. Anytime I was walking around, I would have something to cushion and stabilize my leg. 8 months later, I was like, I got it. I mean, I really feel good. I don't think I need this brace anymore. And so I'd start taking it off and taking it off. And now here I am 54. I don't have any knee problems. And I'm just very grateful that I had that introduction of active isolated stretching at a young age that was very impressionable on me. And then I met Leon Chaitow with neuromuscular therapy. And I kind of feel like I went down that rabbit hole and wanted my money back from my degree because I was like, what? This whole thing I learned in school is like so incomplete. And there's so much more to learn. So I think that this event is really going to be, I think, very eye opening. And
Mm.
for those of you who maybe haven't melted, melt is a self care technique. We use soft tools and soft rollers and soft therapy balls. I actually have my therapy ball that I'm always using while I'm on conference calls and stuff to help people rehydrate the fascia and to learn how to shear the fascial tissues on their own at home, and incorporating that with very specified stretching, I think is really life changing because now you have a reset. So if you want to go to strengthening techniques, that which is the other side of melt, is neuro strength, and again, stabilizing the pelvis, stabilizing the shoulder girdle, and then moving the arm or the leg to try to activate muscles in a more efficient way. Because I think what a lot of people have a problem with is the stabilization aspect of their hip and shoulder girdle is faulty, but the movers are either overbearing or weak. And so if you go after stabilization and then move, well, now you have a recipe for some adaptation and change. So I think that we're there for 3 days together. Am I right?
Yeah, 3 days.
People, yeah, people are going to get doused with great information, easy to learn techniques that they can go home and achieve these great outcomes. So I think that this is just going to be a ball and I can't wait for it. I'm so
Yeah. I
excited.
was going to say the idea of joints being unstable, like your hip. They oftentimes talk about how the ankles should be mobile, the knee should be stable, the hip should be mobile, the SI joint should be stable. And I think for a lot of people, like I always try to wind back the clock and say, how do these things start? Or rather, how can we avoid them? Or how can we get back to the start once things have happened? And I think for a lot of people, it's talar shift means then the ankle isn't mobile, so the knee starts to compensate. What should be a stable joint becomes hypermobile. That freaks out the nervous system, so it starts to clamp down on the hip and say, you need to be more stable because it's moving, what's moving around below is too mobile. And then that starts to pull on the SI joint, and I think it leads to a lot of back pain. And people think these things, ascending and descending syndromes, are mysterious, but they're not. Once you understand the patterns, you can oftentimes just trace them back. And you might start off with, why is your SI joint being required to move so much? And you go, oh, maybe it's the hip is restricted. Oh, maybe because of the knee. So you don't have to know these things start to finish. You simply treat as you find. You see one thing, and that's going to lead you to the next thing and the next thing, and it becomes like a breadcrumb trail. It's real easy.
Yeah, yeah. I mean, I don't think I've ever worked on somebody who has SI joint dysfunction who has great ankle mobility. Actually, never. And it really is. And so when you're working on their ankle and they're like, it's here that's hurting me. And I'm like, I fully understand. I get it. But I always take the indirect before direct approach. And I think that the body does as well. Most of the time, the areas that are screaming out for our help are the victims. And I always make an analogy of a baby. If a young kid came up to you crying out for your help, you wouldn't punch them in the face and go right at them, right? No, you would get down at their level, you'd calm them down, right? You'd settle them down, you tell them everything's going to be okay. Then you would take information in, there's assessment, and then you would make a strategy. And I think the problem is when our bodies are screaming out for our help, we just shoot the messenger. We go right to the areas that hurt us, and we don't consider that, just how you said, if the ankle isn't moving, well, the knee's going to get too mobile, and then the hip gets locked, and then the SI joint gets more mobile. And now you got back pain, neck pain, and you walk weird, and you're complaining all the time. When really, if you just start at your feet, a lot of times things in the pelvis start to feel better. So one of the treatments that we'll teach everyone at the event is the softball foot treatment, because it's easy to do, takes about a whopping 10 minutes every day, and you can do it every day. And I really think that it prepares us, especially if you are going to try to mobilize the ankle, it gets better effect when your tissue's hydrated. It's just going to make range of motion easier. Aubrey, you said that, and I caught that. I was like, wow, I had no idea that I'm guessing that what drew you to the field of bodywork and manual therapy is your dad, because of what he had. So how was your journey, really shaped your philosophy and that foundation of having a family member? I can only just imagine what dinner must have been like at your house. But tell me a little bit about how it's informed your philosophy of what you learned from him.
Sure. Well, I would say like my dad was a really interesting character that he was very much like a business person. He worked in IBM, and my mom actually dragged my dad to their first yoga class when my mom was expecting me. So I oftentimes jokingly say, I started this before I was born. Try beating that. So then he became so enamored with yoga, he decided to go on and study to be a yoga teacher. My mom went to massage school and became a massage therapist. But then as kids, like there's 7 kids in our family. So like on a Sunday, we'd be lined up like Russian dolls, practicing our yoga exercises and breathing exercises and meditation
That's
and
so cool.
even feeling for energy, stuff that people kind of take for granted now. I mean, this was Ireland in the 70s. So it was considered cultish, it was weird, it was really like it was considered a bizarre practice. But for me, I think it encouraged me to follow my own path, to not necessarily be overly influenced by what other people are thinking. I oftentimes say that with even some of the greats that I've studied with over the years, I'd say I never agree with anybody 100%. So I don't just take in information and go, okay, yeah, whatever you say. It's like, okay, that sounds good. Let's try that out and see if it works. So I think
Mhm.
it's caused me to have a surprisingly analytical mind, even though you have a great interest in things that most people would be considered to be a bit esoteric. I'd still find is very much within your wheelhouse. It's part of what I grew up with. We were like eating organic food before organic was a term.
That's
There was a
crazy.
a lady like kind of a mile down the road who had her own chickens that she just reared. She didn't give them any kind of artificial growth promoters or antibiotics. Like, I mean, I'm in my 50s now and I've never taken an antibiotic ever.
Wow. I think
Yeah.
I've taken, yeah, I mean, my mom, when I was younger, I had earaches all the time and they were giving me antibiotics. And my mom said, she gets better in 7 to 10 days, whether we give them to her or not. And so she stopped giving me the antibiotics. And I think I've had antibiotics as an adult twice in my entire lifetime. And I agree with you. Like, it's amazing how when you eat well and you've got a family that might be weird, actually has something to it. You don't need all of those meds, right?
Yeah, yeah. We literally would just, you would eat healthy, you would take
Mm,
vitamin supplements occasionally, like not even all the time.
mm.
And if we got anything like, if we had an earache as kids, I think maybe once I had like a little bit of appendicitis. Wasn't severe. My dad was like, okay, you're eating pears for 3 days. And I ate pears for 3 days, and my appendicitis went away, and my digestive tract is still intact. I still have my appendix. It's simple stuff like that that he was
That's
really just
amazing.
very clued into. He had a really strong interest in how diet affects health. And he, for after he studied to be a yoga teacher, he went on to be a healer. and he would do hands-on healing. Like he would do energy work, and he would recommend corrective diet, and he would get results with things that people were, the medical profession had given up on. Things that are considered to be degenerative. They're like, no, there's only control. All we can do is try and mitigate. This is going downhill. Nothing we can do. And my dad oftentimes, just by taking the philosophy of let's give the body everything it needs, and let's do some energy work to kind of just promote repair, reduce stress. I always look at things in a very practical sense, and I would say, if anybody kind of goes, oh, energy, I would say, well, think about it. Just being in a calm environment with somebody who is that calm, who's radiating calm, is going to bring down your stress levels.
Yeah.
And then you're not wasting your body's resources on maintaining stress. Those resources are now available for repair. So you can take things in a very simple, real world explanations, stuff that is, not particularly contentious. And you can really just say, well, this is how I would make sense of that. Of course, if you believe in how we can influence each other on an energetic level, so much the better. But there's also the simple ways that we can explain these things. So that has really informed even the therapy practice that I would do. That I'd oftentimes find that I will relax into something to the point that you go, I am separating myself from the concern about achieving a result. I'm here to
Mhm.
do the best treatment. And it's a tricky thing to do in a therapy environment. I mean, a lot of the people watching this are probably involved in therapies in some description. That to divorce yourself from the need for a result is a tough ask because you want to help the client. And I would say, yeah, but me getting pressured and worried and then trying to be more forceful with my therapy is actually going to be counterproductive. So it's caused me to take a lot of different twists and turns over the years of my therapy. I went through a phase where I was going, how light can I use pressure and still achieve an effect?
Yeah,
Like
me too.
super, super gentle work. And
Hmm.
then you go, okay, look, at times you just do need to go a little bit deeper, but never painful.
Yeah.
And I think it's really had to cause me to evaluate everything that I do in therapy, everything I do in teaching, every piece of information really that I come across. Like I oftentimes talk about, there's the stuff I don't like to read or watch because I'll say that is part of your mental diet. So I'll even be particular on stuff like that where I'll go, nah, not for me. My sister now is, I think she's a lot more interested in some of the, what I would consider definitely the more esoteric side of things. And she'll sometimes send me reels of different people. And when she'll talk about it, it's really interesting. Ali has a great sense of these things. And I'll get the digest version from her and I'll go, oh, that's fascinating. She'll go, I'll send you the video. And I'll listen to it for 5 minutes and I'll go, I can't listen to that person for whatever reason. I don't know what it is, some intuition, and I'll go, not for me. That's not going into
Yeah.
my mental diet right now. So I tend to be very analytical, even though you have that very kind of non-traditional kind of upbringing, which I thought was an interesting contrast.
Yeah, I mean, I think that that's a really great approach too. How I always think to myself, how little can I do, actually do, and just listen and just try to find the restriction and then just hang on to it for a while and see what happens and see if it lessens, right? So, how little can I do and actually influence a change? And then I propose that to my clients when they say, well, how much multing do I need to do in a day? I said, I go the other way. How little can I do and actually make a change? So
Yeah,
they're like, well, how do I know? I said, that's the protocol of melt, right? You're going to reconnect. That's your assessment. So you're going to assess how much stuck stress do you have in your body. Then you're going to treat yourself, and then you're going to reassess to notice if you've made that change. And if you make the change and you do it in 10 minutes, well, you just answered your question. 10 minutes should be fine. And it is kind of a mind blowing thing for people because I've had people come to me when they're like, they say, I've tried everything. And I said, well, what did you do today? They're like, well, I got up and I meditated, and then I took a yoga class, and then I went to my physical therapist, and then I went to my chiropractor, and then I went back and I meditated again, and then I did my stretching, and now I'm here. And I'm like, wow, you spend and how are you feeling? And it sounds to me like those things aren't working. Why do you keep doing them? And they're like, like kind of short circuits. I'm not really sure. And I'm like, well, maybe you're doing too much and you're not letting your nervous system just take a break. And even if you're meditating, are you really meditating? And they're like, well, I think a lot. And I'm like, well, then that's not meditating. So, so we get into the dialogue of like, what really is it that people need to do rather than what's effective? And I think the effect, people need to feel something, and a lot of times they don't like the light touch therapy while you're doing it because they're like, are you doing anything?
yeah,
I'm like, let's just see later if it feels like something different, right? But it's actually, I think that really veered me into a little bit of a scramble by the time I got into my late 20s, and I got myself into chronic pain, and I started doing cranial sacral therapy, and it blew my mind the changes that I made in my own body. But then I would work on a client who I'd worked on a dozen times, and they'd come back and they're like, I don't even know what you did, but like, I feel so much better. What did you do? And I'm like, I'm not really sure. I I worked on your cranial rhythm. That's about all I can say just yet. I'm just learning, and I'll get back to you when I can actually explain it better. But
Mm,
it's profound. I think the human body is so dynamic, and it's so it can get stuck, but it can also get unstuck. And I think it comes down to how you think about it and your relationship to pain, how you are assuming your body. I keep saying to my mom, God love her, who's in a hospital right now, surviving from another hip replacement and, a leg that was broken. And I said to her, Mom, do you believe that your body can heal? And she kind of like sighs and she goes, I guess so. And I said, No, Mom, it's not I guess so. It's I can. Those are the words that you have to say. I can heal. Mom, you were healed. Her leg was broken and it was healing already, yet it was healing incorrectly because it was a bad surgery. But her body was still healing of something that was wrong, right? And that is so profound in every way. I think the body is just incredible in that way. And I'm also curious, did your father ever write a book?
He was working on it famously. He was talking about writing a book for a long time, but I don't think he really wanted to be honest. Like
Huh.
he was an interesting kind of guy. When he was teaching yoga classes, one of the things he used to love was he would say that there would be such an incredible vibe in the room at the end of a yoga class. Like people would just float out, and he'd say, it's like you touched heaven for a moment. And
Mm.
then he would pack up, and the last thing he'd do, he'd look into the hall, and just as he's about to turn off the lights, he'd go, "Gosh, it's like we were never here." You'd had this
Yeah.
amazing moment where everybody was really connected and in the moment, like you said, nearly feeling back into their bodies. I think this is nearly part of intuition. It's an element of intuition that if you
Mhm.
listen to it, if you listen to your body, like you said, you know when you've done enough, whether it's stretching
Yes.
or melting or whatever you're doing. So they would have this incredible hour and a half of breathing, meditation, yoga poses, and everybody would just feel like they'd been plugged back into themselves.
Hmm.
And Dad would like to just leave no trace, to have created nice change, helped people, move people along in their journey, and then just step back like he was never there. He
Yeah. Well,
never
I mean,
really wanted to create ripples. So I think even though he talked about writing a book, and I think it's a terrible shame that a lot of the great knowledge he had on the use of vitamins and corrective diet in helping to promote health and
hmm.
really cure people of a lot of really random conditions.
Well,
In a
you're
way,
the
it's a
ripple
shame that's
effect. You're
lost.
the
Yeah,
ripple.
that's
Yeah.
true. That's true. I guess I'm the ripple. But I love that idea of getting used to listening to yourself and paying attention to your intuition. Because I even
Hmm.
find this has happened to me many times in class that I'm in the middle of a demonstration and somebody's asking questions and I'm answering the question, but my hands have kept working. At a certain point, I'm going, oh, what am I doing here? That
Yeah.
intuitively, when you get out of the way, you start to do things that you might not have thought of consciously. You might not have worked your way through to that point, but your intuition will oftentimes draw you in a particular direction. And I find it's the same with exercise. When people say they're bored in the gym, I'm like, how? There's so much going on. There's so much to
Yeah.
pay attention to. Same when you're doing your rehab, same when you're doing your melting. That if
Yeah.
you're actually listening to your body, it's an incredible dialogue. And it's endlessly entertaining and interesting and engaging.
Yes, indeed. So, because you're talking about yoga and, even reflexology you had mentioned earlier on, how do you approach integrating myoskeletal techniques with those other type of modalities like yoga?
Well, it's funny. I think they actually blend really well. Um, I think I've quite a different take to the traditional idea of how reflexology works, because I think reflexology largely works through fascial pathways, and I think by working reflexes in the foot, you are affecting. It's almost like you're the puppeteer pulling on the marionette strings. By we oftentimes talk about the reflexes as being like the remote control for the body, and I think
Mhm.
it's phenomenal for stuff that you can release that you couldn't get to manually. Like reflexology is great for sinus trouble and incredibly, I don't tend to use it too much as a diagnostic tool, but it can be used that way. I oftentimes tell a story when people are asking about the effectiveness of reflexology. I had a lady in, I'd taken a case study, I was working my way through the treatment, and the spinal reflexes are along kind of the instep of the foot. And the
Mhm.
curves of the foot actually match like the back of the head is the big toe, and then where the first metatarsal head is kind of the shoulders, and then you've got the curve for the low back, and then the sacrum and coccyx. So you can like count vertebrae as you're doing your what they call bites in reflexology. So I was
Mhm.
working down the thoracic spine and I was like T5, T6, T7, T. Ooh, and talk about intuition. It was like a word flashed across my mind and it said fracture. And I went, it's weird. It's like a little nodule on the bone. It's not the normal kind of like, it's not a soft or kind of congested sort of feeling in the tissue that I'd
Hmm.
normally associate with the muscles of the back. And
Yeah.
I thought, oh, maybe she fractured that bone in her foot, that particular metatarsal. So I'm working my way through the other foot then, and I've nearly forgotten about this one. And I'm like T5, T6, T7, T. Oh, a T8. again, fracture pops into my mind. There's this odd little nodule. And you often have stored this information. You tell the client about it at the end of the treatment. There was some tension in the shoulder reflexes, the digestion was a little bit sluggish. Very kind of common things. And I said to this lady, and there was a funny thing. There was like a little nodule around T8, and she goes, "Oh, I forgot to mention it because it was about 5 years ago. I fell off a horse and I fractured T8."
Yeah, yeah. And you're just like,
You know,
I mean, yeah, those are the kind of things where yeah, it just, you're like, wow, that's
it
kind of
seems
incredible.
spooky, but you're
It
going, well,
calls
that
it
is
up.
what it is. Yeah,
Yeah,
it's
it
there.
calls
There
it up
is
for you.
information there in the body if we are
Yes,
just paying attention. If we're not
exactly.
paying attention, you'll oftentimes blithely go past these things and not even notice. But if you're paying attention, there's signals, there's information. The body is constantly having a dialogue, particularly when you're doing hands-on therapy. And so I would see those as integrating very well into kind of that myoskeletal corrective manual therapy, that getting people out of chronic pain module. Some people need more calming of the nervous system. When there's kind of internal problems, I think things like reflexology are fantastic. When it's more direct stuff, we can work muscles. One of my favorite things, we talk about like the effects of stretches. The bicep is one of the most important muscles for shoulder pain, and it's actually the distal end of the bicep. It seems really counterintuitive, but the bicep, when it's not lengthening properly, acts as a sling and it drives the humeral head up, and that leads to a lot of rotator cuff problems, labral tears, all kinds of dysfunction that's oftentimes then treated as being more severe. And we find if we just release the bicep, we can drop the humeral head, people get full range of motion back, and their shoulder pain can oftentimes go, particularly when you put a piece of kinesio tape on it afterwards and they get full range of motion back and they're kind
Yeah.
of going, wow, okay, I guess I don't need surgery. Same kind of thing you were talking
Yes.
about for your meniscus.
Yes, indeed. I mean, I think in my lifetime, I've probably had many of the thousands of people come in saying that they're going to have surgery. And you're like, I don't know, let's just try this. And sure enough, they're like, I can't even believe how much better it feels in such a little amount of time. I said, but now you have to keep working on it. Now we know what the problem is. I don't know what necessarily caused it, but here's your pattern. Let's not go this way anymore. Let's go that way and see if we can change. And like I said before, I think the body is a miracle. It's amazing that we even have an opportunity to be a human being. And so we should really learn how to tune in. I think a lot of times when people are in pain, they do the opposite. They want to tune it out. Again, I was at my mom at the hospital and they're asking my mom, does she want oxy or does she want some other doxycycline? And I'm like, why are you asking her? And first of all, does she need a narcotic? Like, can't you just maybe give her Tylenol? And she
Yeah.
said, well, she said she has a 7 of pain. And I looked at her, I said, Mom, do you really have a 7 out of 10 pain? And she just looked at me, she goes, mm. And I was like, just because you want to zone out, I said, Mom, I'm telling you, zoning out isn't going to make you well.
Mm,
But I get it. I don't want you to be in severe pain, but you got to be honest about your pain in a hospital. Otherwise they're going to drug you out and you're constipated, right? They're giving you this stuff. This is why you're constipated. And I can't imagine you being on meds that you're going to get addicted to. Please don't do that. So it's
yeah.
just like sometimes you just need another person to sort of shake you and say, cut that shit out and start
Yeah.
doing it that way. And
Well,
so,
it's interesting that on that topic specifically, there was a study done where they had patients post surgery. They checked their pain levels on a scale of 1 to 10, and they had two different groups. One group was automatically administered morphine every 2 hours, a set prescribed dosage. The second group had a button, and they said, when the pain goes too high, click the button. And they came in and they had the mark on a 1 to 10 scale, how much pain do you have? And the guys with the button were putting it at twos and threes. The people who were getting the automatically administered morphine were putting their pain at sevens and eights. And they said, you'd imagine then maybe it was trigger happy. The people with the button were just like, I've no pain because I keep hitting the morphine. They found they used far less. And
mm,
it was because they were empowered, they were able to take control. And I think that's what the home care is going to do. It empowers people to deal with their pain rather than try to run from the pain, try to get away from it. That
that's it.
that that simple experiment showed how pain is a perception, and you feeling that you have an element of agency really changes your perception. That it diminishes your pain enormously. And like, I mean, there are cases where people do need surgery. There are cases where people do need medication. But there's an awful lot of times where if we just do the necessary things to maintain ourselves, to promote, as you said, the amazing piece of machinery that we've been given for this life to operate within, if we actually just understood how to care for it, maintain it, and when we recognize these kind of warning signals for what they are, not
Mhm.
the enemy, pain is not the enemy, pain is a warning signal, that we then know what to do about it. And that's the key thing. That's the empowering part.
Yeah,
And like for your mom,
totally.
instead of trying to run away from it, connect in and deal with it, you know?
I know we're going to get her out of that hospital though.
Absolutely.
She's gonna be better for it for sure.
Mm.
So let's talk about let's say new people to the industry. Somebody's coming in, they're saying, "Hey, I think maybe I want to be an aspiring therapist." What kind of advice would you give to somebody starting? What would be a good starting place for them? What might be something that they're not thinking about considering before they jump into becoming a therapist?
I think the treatment of chronic pain is one of the most rewarding areas to work in. And it's funny because at our last big seminar, we had James Wozlowski as you said, we had Eric over in 22. We've had
Hmm.
James over a couple of times. You're coming over now this October. But there was some guys who came back who had trained with us. And in some ways, I'm kind of envious that I'd go, it took me 20, 25 years to get to where these guys are getting to in 3 years. That they said, having done the 3 year sports program that we do, they said they're now maybe a year practicing, and they said already I'm kind of like booked out 6 months ahead. I'm turning clients away. I've more business than I can manage. So I think getting into that side of really understanding patterns, being able to treat those kinds of dysfunctions, um, pursue knowledge, pursue education. Don't just think because I've done, my massage school, I've gotten licensed. I would say definitely continue to study. I mean, I think I'm up to 60 different certifications, qualifications, and diplomas at this stage, and I still am learning. I'm taking another seminar in 2 weeks' time. That I'm always going back and being the student. That as you learn more, you start to see more, you see the commonality, you see the patterns. We talked about how I studied taping and then I went and said, okay, well, what do I do now with that? Because when I go to take a class, I always say, I'm the dumbest person in the room because I leave everything I know at the door and I'm going, okay, I'm going to soak in like a sponge everything you tell me. And then I'm going to go back into clinic next week and I'm going to see how does this apply? What works? How does this tie in with what I know? Then I go through a process of integration. So continue to study, be open to new learning, and then test things out. See what actually works in reality rather than just taking everything that you're told on face value. I think that's
Yeah,
the best
yeah,
advice I can
I
give.
love that. I mean, I just got back from taking Jaap van der Waal's 4-day
Yeah.
embryology course. It was called The Embryo Within. It was kind of like taking an entire semester in 4 days. I
Yeah.
walked out of there going, God, I had no idea. And I didn't have children. So I was really kind of blown away at just some of the things and the way that he described it was so beautiful. And now I think I'm gonna go online. I'm gonna take your taping course. I love that one. I mean, I've taken a few in my day and I love them. And I just always feel like when you learn from somebody else, you always come out with something else that you didn't have before. God, I never even thought about doing it that way. Like even I took one course and they were like, yeah, sometimes you can split the tape and just use that same piece of tape instead of two and draw
Mm,
tension on a thinner line and then create a crossover. And I was like, yeah, why didn't I think of that? Like, duh, right? But
yeah.
boy, that really made a difference. So I
Yeah.
totally appreciate that. I think that's very good advice for anybody. So I ask everybody who comes to Anatomical Gangster the same question near the end, and I still have one more question before this, but I'm going to ask you this question first. If you could tell somebody something that you've learned in your lifetime that
Mhm.
completely changed the way that you were thinking, and if they understood it, maybe it would change the way that they're thinking and could very well change the course of their life, what would it be?
Gosh, that's a tough one. From a therapy perspective,
From anything, just something that you've learned in your life that really changed your way of thinking about the human experience. And if somebody else heard it, it might just change their life too.
well, one of the things that really changed, because I always think that there's two big things in therapy in particular that changed my life really quite dramatically because I was hugely into adventure sports, still am, but it was always like board sports, skateboarding, wakeboarding, things like that, and you're always kind of twisted. So, despite being a yoga teacher in my 20s, around late 20s, I started to develop pretty severe back pain to the point that like I could barely walk. I couldn't walk more than 50 yards. And it's kind of embarrassing then as a therapist, you're kind of limping around, you're trying to hide the fact that your back is in pain. And I had this for quite a few years. And this was one of the things that really convinced me about James Oslowski's work. He was over here in Dublin. Myself and my sister took the seminar. She did a direct psoas release technique on me, pain free, fantastic. I thought at the time, oh, that feels pretty good. And when my back pain would manifest, would be if I was sitting down for more than kind of 10 or 15 minutes. So we went up to the hotel room that night. We're sitting down for a while. I'm waiting for Ali to get ready. And then we decide we're going to go down and get dinner. I've been sitting for probably 30 minutes at this stage. And I just got up and walked across the room. And I stopped in my tracks and I looked back and I went, whoa, I've no back pain. And what has stuck with me is over the years, I've seen a lot of people attack the idea of you shouldn't do direct psoas work either because it's not safe, or they'll say you shouldn't do, or you cannot reach psoas through the abdomen, that you're deluded if you think you can work that deep,
That's
which
not true.
interestingly, yeah, that this has been disproved. There was a really good reel release recently where they put somebody in an MRI and they palpated and they showed they could actually get down to psoas. So that's
Yeah,
just
of
been
course you
disproven.
can.
So those are the two arguments that I hear all the time on social media. Either you shouldn't do it because it's dangerous, or you're deluded if you think you can even do it. And because it changed my life so much, I've been an absolute advocate of do direct psoas work. Do your due diligence. Check for the kind of contraindications. There are things that would make the performing of direct work on psoas unsafe. We've got indirect techniques for that. You can still do stuff. But I think don't shy away from techniques that work. What I really learned from that was don't throw the baby out with the bathwater. If it works, it works. So that was one of the
Well,
most profound. And the other was, I would say, pelvic torsion correction was a massive change for me. So maybe I might say to therapists that are out there, if you are only doing soft tissue work and you think that joint work is scary, I would encourage you to study some form of joint work, whether it's myoskeletal or osteopathy, whatever it might be. Practice within your scope. Don't just start popping people's joints, but I would say incorporate, because we are an incorporated being. Learn to do soft tissue work, learn to do fascial work, learn to do joint work, learn to do neurological work. If you can
that's right.
work those three systems, you will have profound changing effects for your client, life changing effects.
Yeah, I agree with that. I mean, really, you have to know what you're doing. And I hear clients sometimes say, we don't even know what we're or like therapists say, we don't really know what we're doing when we're doing these things. And I said, I feel like I
I
know
think
what I'm doing
I
when
think
I'm
you should.
I think it would be good if you actually knew what you're talking about. I don't know what you're talking about, but yeah, I mean, I agree with that. I think that it comes down to practice and getting great teachers, and then more practice, and then getting more great teachers, and then going back and looking at what you've learned, and then go back and practice again, and then just keep practicing. Because if you stop practicing, things, it's like anything, you pick it back up, but you got to keep doing it. So I know, Aubrey, we've said it. We're going to be together in October. For those of you guys listening, we're going to be together October 17th to 19th, and we're going to be in Ireland. I can't wait to be doing this with you. It's so fun. But what else do you have? What's next for you? Any upcoming projects or areas of research that you're really excited about?
There's always upcoming projects. We've done an awful lot of adding to our video library over the last few years, and what we're actually going to be announcing probably next week is for my book that you mentioned, the Myoskeletal one. We are doing that now. We're going to start launching individual chapters online, so people can just dip in if they wanted, like say, okay, what's the lower leg chapter? They can just buy it chapter by chapter. It's digital, so it's nice and inexpensive. You can access it on your phone or your device or whatever. And we're going to launch chapter one, which is kind of just an introduction, a bit of an overview. I want to launch that really cheap. We're going to put that out for like about €1. It'd be just over $1. The chapters are generally going to be maybe about $7 or $8 each, so they're really accessible. I want to make it that it's affordable for people to get, and it being an online reader, like I said, it's not like you have to lug around a book. If you buy a chapter and you like it, you can then buy the next one. It's going to be kind of serialized, so we're going to put out nearly like a chapter a month, and I just like that idea of people not necessarily wanting to buy a whole book or ship an expensive book, because that book's a hardback. It's a heavy sucker. So that's kind of expensive. So having a digital one means you get instant access. You can pick and choose the body parts that you're interested in. So if you get a lot of clients in with, say, neck issues, you might say, well, let's just buy the neck chapter. And if you like it, it's a great way of people dipping their toe and then saying, actually, I'll get the chapters as they come out. So we wanted to serialize it like that. So that's the next project that we have coming up. But that's kind of small compared to most of our projects. We tend to be pretty ambitious. So yeah, we have a couple of other seminars and things in the pipeline. One or two things yet to be confirmed. So we should have more news about those maybe in a while. So yeah, yeah. The digital versions of the book being released in chapters, I think, is going to be an interesting one.
Yeah, absolutely. Well, I mean, again, I think you're such a fantastic practitioner, and all of the amazing things that you put out there. Your stuff is world class. I think all of you guys who are listening, you guys should go check out Aubrey's work. How can they find you if they want to check out your stuff?
Sure, everything is on our website. It's hcd.ie. So, like the initials of the college, Holistic College Dublin, hcd.ie. I'm on Facebook, it's just my own name, Aubrey Going. And on Instagram, it's Aubrey Going CMT for corrective manual therapy. Yeah, so, and people can just reach out to us through the website if they have any questions.
Well, perfect. I'm going to go ahead and put all of this in the show notes so that you guys can stay connected with Aubrey. And of course, as always, I'm so appreciative that you guys have listened to this podcast. Please make sure that you subscribe, share this with your friends, and any of your friends who are therapists, make sure that they check out this podcast because it's always just chock full of great information from great practitioners and such. And I look forward to seeing all of you guys soon. So as always, stay curious, stay hopeful, and stay amazing. We'll see y'all soon. Well, I hope that you enjoyed that conversation as much as I did. I learned so much just talking to Aubrey in just an hour. He is such an amazing practitioner. All of his trainings online and also live. He's just such an incredible educator. So I hope you check out his work. And of course, I will be with him October the 17th to the 19th, and we'll be together in Ireland doing a stretch and melt event. So I hope that you will join us and find out more in that link in the show notes. And again, thank you so much for being part of this podcast. Subscribe, share it with your friends, and keep your mind open for new ideas. I'll see you on the next podcast. See you soon.